Outbreak of lepto in Edmonton, Alberta. We found where it all started and got the vet to talk to us about it. Let's go to Dr. Sotoso now.
Hi, Catherine. Thanks for having me on today.
Thanks for joining us. So tell me, doctor, how did the whole outbreak start?
Yeah, we had a patient, Freddie, come in a couple of days ago. He was presenting with a fever, he was vomiting, he had some muscle spasms, some abdominal pain, diarrhea, he wouldn't eat at all. He was very weak, very depressed, very stiff, and very severe muscle pain. He had a history of being outdoors in their backyard, which leads me to believe he caught leptospirosis from a wild animal.
Oh dear, okay. And what was your reaction? What did you think? How did you figure out that it was leptospirosis?
We did a physical examination, ran some blood tests, and did some x-rays as well. We still wanted to be absolutely sure, so we did an abdominal ultrasound to see if the organs were affected and how far along they were. We then started treatment right away because the final check of levels of antibodies can take days, and we did not want to let this get out of control. Leptospirosis can be fatal.
And so after doing these tests, you found out he had leptospirosis?
Leptospirosis bacteria, which is also known as yellow fever, Weil's disease, and 7-day fever. Leptospirosis is a disease that impairs kidney function.
Just awful. What was the prognosis?
Fortunately, sugar gliders can survive if this disease is noticed early enough and rapid aggressive treatment is taken. So we started him on antibiotics, dialysis, and hydration therapy. It is important to know that from exposure to bacteria to development of disease, it usually takes 5 to 14 days, but can be as short as a couple days or as long as 30 days or more.
So he's going to be okay. That's great. Good thing we have caring veterinarians like you here in Edmonton to help keep this under control.
Thank you so much. Thanks for having me.
Well, that's great. I'm glad he'll be okay. Now we're going to check in with another veterinarian who's somewhat of an expert on the leptospira bacteria. Let's take it to Dr. Longbottom at his home because, unfortunately, he is ill with gingivitis. Hi, doctor. Thanks for making time for us, even though you're sick.
Whatever. Hi, Catherine. I'm feeling in the weather, but if I can get some information out on leptospirosis, then I'm happy to help.
I know you're very busy, but what can you tell us about leptospirosis in sugar gliders?
Leptospira, the bacteria that causes leptospirosis, is spread through urine of infected animals. It can be direct or indirect. Urine can get into water and soil and survive for weeks, months. Bacteria can enter through skin, mucous membranes, especially broken skin. Drinking and handling infected water can also cause infections. Shedding can occur from a few months to a few years. It is very transmittable through contact with wild animals such as raccoons, skunks, squirrels, opossums, or deer.
Okay, so that explains how it can be so infectious. What about some symptoms our viewers can notice at home?
Yes, clinical signs vary and animals may be asymptomatic. The signs are nonspecific, so it can be mistaken for other diseases. Symptoms include vomiting, diarrhea, abdominal pain, refusing to eat, weakness and depression, stiffness, severe muscle pain. Generally, young animals are more symptomatic than older animals.
So it must be hard to find out if it's leptospirosis just from symptoms alone.
Yes. Since its symptoms are flu-like and very broad, there are many diseases that can be mistaken for leptospirosis.
Good. How urgent is the problem, doctor? Is veterinary expertise required? Do you know if veterinary healthcare workers or other patients are at risk? Is it zoonotic?
Yes. Zoonotic. Very infectious. Very urgent. Since it affects the organs, it can be treated, but will need to be taken care of right away.
Oh, wow. Okay, and how is it?
You can get your pet vaccinated against leptospirosis. This doesn't provide 100% protection because there are many strains of leptospira. It is still recommended and important to get the vaccine because it helps. There are other steps to prevent leptospirosis, such as washing hands after handling animals and their food, water, dishes. Make sure sugar gliders don't bite. Bottom incisors are made to bite through tree bark, so they can cause significant damage. Be sure to clean any surfaces where a sugar glider has been, as it may have urinated.
Thank you so much, Doctor. Unfortunately, that's all the time we have, so hopefully our viewers are more aware of the disease and they have some useful information on it. Thank you for teaching us, Doctor.
My pleasure.
Thank you.